Shima, are you with us?
Yes, Dr. Dua, how are you doing? Assalamu alaikum.
Yes. Alaikum assalam, Dr. Shaima. Actually, bossed the bases earlier. Yes.
Yeah,
I
yeah,
didn't like congratulate you before. I didn't like give you your certificate. So this is your certificate.
yeah. Thank you very much. Thank you very much. It was my pleasure, really, to be your first candidate. I
Yes.
think
Yes.
you were the youngest tutor for me, and I was the first candidate for you. But
Yes.
really, you helped me so much. Because of you only, I was able to put it all together. We
Yes.
practiced very nicely before the exam, and it was really very great help from you. Thank
Yes.
you very much, Dr. Dua.
Thank you. Thank you, Dr.
If you
Shaima.
ask me about my experience through
Yes,
PACES, I
please.
also
Yes.
passed for the second time.
Yes.
First time it was in Egypt, second time it was in Ajman, UAE.
Yes.
Some few advices I will just say: practice and practice and practice on daily basis in all skills, and know yourself. Because if you don't know where is your defect, you will not be able to do it. And I was lucky second time to have a group of doctors where we were practicing almost every day. Every day the group was on, and whoever is free, they will practice together. They helped me so much. Before the exam, I made some checklist for all kind of examination, starting from like classic examination, chest, abdomen, neurology, then the subspecialty like Marfan, rheumatoid, and every day I was doing those examination, revising on my nephew. So
Yes.
I used to do it daily based all kind of examination. So in my exam, I was very fluent in examination. I used to see myself in the mirror, how is my facial expressions, how do I look to the examiner, and I used to watch my body language also. And
Yes.
whenever I have in the clinic, I used to do this with my patients. So it's very important to familiarize yourself in the exam settings, because what happens that when we go in exam hall, we get confused. We feel like quite an anxiety, which is normal. But it depends how much you're practicing. It makes you very familiar with the case, with the examiner. This was my problem actually. First
Yes.
exam, the examiner was quite harsh with me, and this made me like very upset, and I didn't finish my history. But if you look now retrograde, I don't know why I got upset. He just commented like when I asked the patient, do you have any joint pain? He interrupted me and he told me, doctor, this is you should know during examination, which is not allowed. He should not say this to me. But
Yes.
I realized later that people are variable and you should expect such attitude during the exam. So it's very
Yes.
important to know how to control yourself. This was my problem in the first exam. As Dr. Dina said, sometimes we don't know what they want. This was also my problem in the first exam. And golden advice: don't be preoccupied with one diagnosis and try to make all the things on this diagnosis only. Be logic in your thinking, because it happened to me. I just got one finding, then I made all the diagnosis in this. And the examiner was trying to help me, but I was not smart enough to understand that he want another differential diagnosis. They want to be sure that you have a lateral thinking. Like it
Yes.
was a patient with confusion, and on examination, I just got hepatomegaly.
Yes.
But I didn't include in the differential that this patient was diabetic, this patient without any knowing of his control, this patient had dysuria, this patient. So didn't keep the diabetes as a differential in this patient with a hyperglycemia, with a hypoglycemia. And it
Yes.
was very important differential. And the examiner was trying to help me, but I was only like saying this is only decompensated liver disease. But it was not the case. So he reduced my mark so much. So
Yes.
always be logic the way you are thinking. They wanted to be sure about this. Like, how come you forget the diabetes in such a patient, which is very common
Yes.
presentation?
Yes. Yes.
This is the only was my problem in the first exam. Alhamdulillah, second exam, I did very well with the help of Dr. Dua, really, and with the help of my all friends who were studying together every day.
Yes.
The only thing in the don't give up in exam, don't lose hope, because in the second exam I was thinking to leave the exam hall because I felt I didn't do well in the LSCC. It's a very stressful exam, so I
Yes.
felt really I need to leave the exam. But Alhamdulillah, I just counseled myself in 1 minute. And I said, inshallah, everything will be fine. And after this, all the stations, I did it very well. So always don't give up in the exam. This is not the end of life, and I always say it's a one-way exam. All of us will pass the exam, but in a different station. And
Yes.
every time you go another trial, you will feel that you are really got more skills, individual-wise, practice-wise, and it's not like waste of time. No, it might be waste more money, more time, but it is very helpful. Now I feel that second time helped me a lot to build up my skills. And
Yes.
really this basis exam, it is very helpful in your practice with the patient. It makes you
Yes.
alert about what is the priority, what to ask, what is the red flags, how to speak to the patient, how to communicate with the patient. It's very really good exam, and thanks to them that they give us the hope to do post graduation. Being out of Egypt, it was very difficult to do post graduation unless I got really engaged in this MRCP. So hopefully, inshallah, all of you should pass the exam, inshallah, with very good scores. And best of luck for all of you. And really, thank you, Dr. Dua. Really, you helped me so much. Dr. Dua, really, you can say that she put it all together for me in all skills. Like like first trial, I did many courses, which everybody definitely helped me. But with Dr. Dua, this is the only course I took second time, maybe only two courses I took, and she was able to give me a lot of cases, a lot of differentials, how to examine the patient, because not everybody do this. Somebody will be very good in differential, somebody will be very good in history, but really she was very helpful to me, that how I will examine the patient, what is the priority for examination, what is the differential, what is the examiner questions, how to answer it. It was really very helpful course. Thank you very much, Dr. Dua.
Actually, Dr.
Thank
Shema,
you
you were
very much.
excellent. You were excellent, excellent candidate. Actually, all you need was a little bit confidence. I was like shocked
Yes,
how you are not. You were excellent actually, and during the stressful moments, we can't see our strength. So after that, we
yes,
just realized that oh, yeah, we were very well prepared and we studied hard.
yes,
Yes.
yes,
Okay, so
yes,
if
yes.
you give
Thank you very
advice
much.
to someone who
Mm.
is starting preparation, okay, so that he is very time
Yeah.
concise and not to waste money, step by step, starting with the clinical, so what he will do.
Mm.
Yes,
Actually, I advise to start to have a group, and this
yes,
group definitely it will be like daily based practice. Have your own partner who knows what is your defect, and he will work on this. And always try to engage with somebody who tried in the exam one time or two times before. Don't take new partner who is very new to the exam. Okay, have a mentor, or don't waste your money in so many courses. Have a good tutor, and he will know what is your problem, and he will work on this. That's
yes,
why I felt Dr. Dua course was very helpful in this part. Don't waste your time too much in the books. However, I like a Ruch book so much. It's very pleasant book. This is the only book I can say it helped me really so much. After
yes,
this, I was relying mainly on the courses.
practice.
So yes, courses and practice.
Mm,
But second trial, I was mainly practicing, and I took Dr. Dua course, and
yeah,
it was really more than enough for me. So the good thing I felt really in your course, Dr. Dua, I'm not just saying this because you are there, that it was very informative. It was a lot of information, how to be systemic in the history, how to be systemic in the examination, and how to give a good differential, and how to answer the examiner questions. This is what I
yes,
needed only. I didn't
yes,
need anything more than this.
yes, 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 you are right, you are right. We don't need any waste of time in more in knowledge in depth.
Yes,
No need.
yes. And
Yes,
always be simple. I used
right.
any case, I used to like come through it. I used to read it fast in the chat GPT just to know
Yes,
what is this case. A chat GPT is more than enough for
more
me
than
always.
enough.
What is the
Yes,
presentation? How to investigate it? What is the differential diagnosis? And so I will revise the case. Again, any case come, I will just revise because there is no time. There is no time like they will sit and you will study this case, this case. And whenever we practice any case, I used to practice again with my colleagues. Again, I will practice it, because when you repeat the practice of the same case, same diagnosis, even if you know, you will be able to be familiar with the case. It's a
yes,
matter of being familiar in the exam settings. familiar
Yes.
with the patient, familiar with the examiner, how to present yourself, how to push them to help you to pass the exam. Because if they feel the candidate is really good, or they're satisfied the way he is, they will try to help him to pass the exam. But if they feel the candidate is not confident, like one of my friends, they failed her because they told her your voice is not loud and is not clear. And she told them, at least you could have been stopped me. And they told her, we are not allowed to do this because they felt she is not confident enough to work in UK. This is their always scope, that they want this candidate to work with them or no.
Yes.
So always try to work on yourself, because all of us are variable in the body language, in the facial expressions, in the voice speed, in the voice tone. So try to, if you are a beginner, try to work on this more than being knowledgeable in the medicine,
Yes.
because with these skills only, it's very important to pass the exam.
Yes, yes, yes. Excellent, excellent, Dr. Shaimaa. This is the point. It is not a matter of reading through books and listening and listening. No, to practice, to perform.
Yes, yes, and really, it's a very nice journey. I enjoyed a lot.
Yes, I enjoyed
After
more.
passing the
Yes,
exam, I can
yes.
say this really.
Uh,
Alhamdulillah.
Alhamdulillah,
Alhamdulillah.
Alhamdulillah, Alhamdulillah. Okay, thank you, Dr. Shaimaa, for your
Thank you
time
very
and
much, Dr.
effort.
Bol. Thank you.
Hope you all the
Thank you
best.
very much.
Okay,
Inshallah.
inshallah. Dr. Rana, are you with us? Dr. Rana?
Yes, Dr. Dai.
Yes. Okay.
Yes,
Congratulations first.
yes. Thank you, Dr. Dai. But what I wanted to say is that this is the first time I entered this exam. Alhamdulillah, I passed it.
Alhamdulillah,
Uh,
Alhamdulillah.
Also, what helped me is the practice. The most important step in this exam is to
Tell us
practice
our
and
journey,
practice.
Dr. Rana.
Also,
Actually, you were excellent. So I need to listen from you from day one to day to the finals. How did you go through this exam preparation?
yeah. I passed part 2 MRCB on April on
Yes,
previous April. Then I prepared for this exam only for about 3 months. But I did have a previous medical knowledge, because I already passed the part 2, which helped me a lot. And then also what helped me is the practice and the course of you, Dr. Dua. Thank you very much. Really, it was a fantastic and beautiful course, because لان حضرتك فعلا يعني كنت بتجيب لنا الكيسات، وكنت بتعمل ديفرنشال دياجنوز الصراحه يعني واسع جدا. فكنت بتخلينا ان احنا على طول يعني
طيب
البراكتس،
لما
ومش
دخلتي
مش
الامتحان
بنحس.
حسيتي قد ايه من البريباريشن جه شبهه؟
لا يعني كانت كتير جدا. كنت يعني كنت حاسه نفسي فعلا ان انا زي بكون ببراكتس في الكورس بالظبط يعني.
امم
يعني السيستماتيك ريفيو اللي حضرتك برضو كنت قايلها، السكيما اللي هي الاولانيه ديت، كان الواحد بيقول
امم
الصراحه الاسئله ورا بعض مش بتحتاجي حتى كمان ان انت تفكري، لان اصلا مفيش وقت في الامتحان ان انت تفكري، لازم تقوليها كلها ورا بعض.
امم
ف هو فعلا برضو في اللونج كونسلتيشن كيس بيديكي فعلا بوزيتيف فايندنج قليله عشان تحاولي ان انت توصلي للتارجت دايجنوزس. بس اوفر اول اللي ساعد الواحد صراحه الكورس بتاع حضرتك فعلا كان يعني كان حلو جدا. فيعني انا فعلا بشكر حضرتك جدا والله على
ربنا
التعب فعلا اللي يعني اللي
يبارك
حضرتك عملتيه.
ربنا
اه
يبارك لك.
اه
طيب انت كنت
اه
بتتعاملي ازاي يعني بالبريباريشن بتاعك؟ ماشي، كنا بنحضر الكورس، انت مع نفسك بقى كنت